I'm Leticia Flores. My pronouns are she and hers. I'm a UT Psych faculty member and director of the doctoral program Psychology Training Clinic. I'm joined by my two graduate student colleagues, Rachel and Sarah, who will be assisting me throughout the day. And I am delighted to present several speakers today who come from and or work with the transgender community here in East Tennessee. They bring a wealth of experience and level of expertise that will benefit us all who seek to enhance our knowledge about and competence in working with this community. I'm going to allow Sarah and Rachel to introduce our first slate of panelists who are members of the trans and non-binary community who have agreed very generously to speak to their personal experiences of seeking and receiving healthcare in the area. So I'm going to hand it off to you, Rachel and Sarah.
Good morning, everybody. My name is Rachel Maskin, and I use she, her pronouns.
My name is Sarah Johnson, and I use she, her pronouns as well.
So we'd like to go ahead and introduce our panel. Our first panelist is Katie Ross. Dr. Ross uses she, they pronouns, and Dr. Ross is a queer non-binary scholar whose personal and professional lives are both heavily steeped in queerness. Dr. Ross's publications focus on communication about and with members of trans and queer communities. As Pellissippi State Community College faculty, Dr. Ross serves as a Safe Zone training team leader and a Pride Club advisor. They also co-moderate the local social group, Keep Knoxville Queer.
Corey Xavier is a licensed master's of social work. He uses he, his pronouns, and he views therapy and the world through an intersectional social justice, trauma, and attachment informed lens. He works with individuals, couples, and families living in Maryville, Tennessee, and Knoxville, Tennessee, as well as other areas of Tennessee. He has experience in this area of transgender health for children, teenagers, and adults, and he provides letters of gender affirming medical interventions. Corey is LGBTQ plus kink and polyam safe, knowledgeable, and affirming. He is a certified out health provider. Corey provides free letters for individual gender affirming medical interventions.
And finally, we've got Oscar Anderson, who uses he, him pronouns. Oscar describes himself as a huge advocate for LGBTQ rights and for individuals. Oscar identifies as a trans male. At 21, he shared with us that he's currently recuperating from top surgery. Oscar wants to share his advice and what he goes through on a day-to-day basis. So our first question is just, what's your experience navigating the healthcare system been like? What's felt challenging about it, harmful or ineffective, and what's felt positive or helpful? So maybe just the way it's arranged on my screen, Corey, let's start with you.
Nice. Usually my last name keeps me not from starting at the beginning, but all right, we'll go for it. It's been a mixed bag for me, and sometimes it's difficult to parse out whether or not it's been because I'm trans or because I've spent most of my life being working class and not having access to healthcare or insurance. You know, I think when I first moved down to Tennessee about 5 years ago from Boston, I managed to find somehow a secret Facebook group for trans guys, and asked about where to go to start T. Planned Parenthood wasn't offering it, nobody was, and I got a referral to a doctor. I had a terrible experience, and I ended up starting hormones actually in Chicago at Howard Brown. I had to travel 8 hours out of state to get proper care. And by the time I came back, Planned Parenthood was offering it, which was great, but I also had a mixed experience with Planned Parenthood. And I'm on their local community board, and I still have issues with Planned Parenthood. So, and some of the stuff that's happened there. Now I'm trying to get trans healthcare through the VA, also a mixed bag. So just honestly, like, complicated. What's felt helpful is when people just listen, and ask questions but also, you know, and I'm more comfortable being like the first trans person someone meets. I'm comfortable answering all the questions of providers when they're like, wait, what? But also, you know, I have, aside from one provider, I've yet to, like every other provider I've had to educate. And it gets exhausting sometimes.
Thanks, Corey. Oscar, what about you?
Well, I've only been in Tennessee for about a year now. When I moved here, I ended up going to Planned Parenthood. That was my first experience trying to transition. And I also had a very complicated experience as well going through Planned Parenthood. It was very comfortable for me, but it was also confusing too. They kept, you know, rearranging my doses and they weren't communicating with me very well. I ended up actually switching over to a different organization now recently. But I definitely have had a hard time. But recently with the organization I go through now, it's a lot easier and simpler. I use Plume for my hormone therapy, but I definitely have had to educate as well. And I, yeah, sorry.
Thank you, Oscar. And what about you, Dr. Ross?
Yeah, I think my experience is a little bit different because I have not been on hormones. I've not explored in depth any medical aspects of transition at this point in my life anyways. And so even still, as a non-binary queer person, it's been frustrating, certainly, but I would say in fluctuations, right? So for instance, when I was in Ohio, of all places, in my PhD program, I had an amazing doctor through the school, but most of my experiences in the Southeast have been subpar. I think ultimately, one of the harder things is doing the search for an inclusive provider, because it's hard to determine which doctor and their office, right? Because we can't forget about the front staff. Which of those are kind, understanding, welcoming, not even to mention the education component, right? Because I think that's pretty widely known that there's just a lack of education in general. So, you know, kind of echoing on the others, I have certainly also had to educate my providers in certain ways. But in terms of what has been helpful or positive, a lot of the inclusive language. So for instance, asking how many male or female sexual partners have you been with in the last year, right? There are certain nuanced ways that you can ask questions that aren't invasive or presumptuous, that are that veer away from othering the patient in a way. So I'll stop there.
Thanks, everybody. Anybody have anything you want to add based on others' comments? Okay.
So my next question is of the many barriers to effective healthcare for transgender individuals, for example, legal discrimination regarding access to healthcare, lack of appropriate programs, shortage of providers who are knowledgeable, which do you see as the greatest challenge to transgender health overall, and just kind of why?
Same order. Okay.
Yeah, that probably is the easiest.
All right. I think, you know, I tend to come things from a systemic point of view, because it's my politics, and then I added in the social work background. And so I think for me, I keep looking off because I have the questions written out, by the way. So like to make sure I remember. You know, so I think like the financial barriers, and you know, when you don't have stable housing, when you don't have stable employment, when you can lose your job at any minute if, you know, someone decides that they don't want to have, you know, queer, trans, you know, anyone at their job. When you don't have family support, when you just trying to find community. doctor is going to be the last thing on your list to do. You know, and then I think that there's people who can do this work and people who should do this work. And I think those two aren't always the same people. You know, I know people are like, well, I'm cool with LGBTQ folks, so like I can be a provider for them. And that's not the same thing. I think especially in the mental health field, where there just needs to be not just more knowledge, but like the cultural competence piece is not just, well, I know what all the letters mean. You know, and so I think the health insurance, lack of programs, all of it. And I think, like, you know, Dr. Ross said earlier, that finding providers and just even knowing what it means, because if they say LGBTQ, like I said, the first person I was referred to was given high marks by several people. And, you know, the experience I had with them was, you know, they had me sign a blank release form and insisted I needed to sign a blank release form before I could see the provider. Then they outed me to my insurance company, who would have had no way of knowing I was trans, because my ID was changed and it was new insurance. And then said that my insurance didn't cover trans care, but they would basically sell me a script for $100 and something. But they weren't going to show me actually how to do anything with the hormones. And that was someone who was recommended by several trans people. And I said, oh, okay. So like good healthcare down here means that like they're not going to tell me I'm going to hell. That's a very low bar. And so, yeah, I think that's just too many barriers. And the gatekeeping. No.
Thank you, Corey. Oscar, do you want to go next?
Yeah. So I have recently just got top surgery about maybe 6 months ago. And when I was in the market to look for my surgery, I realized quick that I had to pay out of pocket for my surgery. And I wasn't against that, but it was very hard to get approval rates to get that covered by insurance, which I actually didn't have, but I was in the market looking. It was very difficult, and the surgeon I went to specifically definitely fights to get them approved, but it's very difficult. I have found out, but I also did face a lot of like discrimination recently when I moved here to work for a different company before I work for who I work for now. It led to a very traumatic experience where I ended up having to sue the company I worked for because the supervisor decided to not accept me for who I was and refused to call me by the right name or call me by he, him pronouns. And it escalated to where it went to HR, and then they actually ended up siding with her as the individual. So I ended up leaving. I ended up just leaving and going back to the company I work for now. But it was a very rough experience because I was pre-op everything, and my cat's in the background. I'm so sorry. He like wants to come out of the room, and I'm just like, no. But it's just like, especially me being so young, I am just now having to learn and figure out this. How to transition almost. I didn't have that support growing up, so it was very difficult moving here and trying to find everything, but I'm much further in my transition than I ever thought I would be. But I faced a lot of I guess experiences, starting hormones, you know, getting my surgery, the discrimination I felt, especially not having a lot of support, but having support within the people I have around me. Yeah.
Thanks, Oscar. Dr. Ross, do you want to go next?
Sure, yeah. So I think everything, Sarah, that you listed are certainly prominent issues. However, being that I have an academic educational background that I do, I would say that it starts with education, awareness, and action to make any changes worthwhile. And so therefore, right, if we were to pinpoint one of them, I would say the shortage of providers who are knowledgeable and culturally competent, much like Corey said. I would say that that's one of all right of the greatest barriers. There's certainly many. However, I would argue because of that, right, those who are in attendance today, I think it speaks volumes, right? It reflects on your willingness to learn, and therefore kind of relieve a bit of the pressure that's placed on trans and non-binary people to educate their providers about their own healthcare. Because I mean, Oscar, thank you for sharing your experience. Wow. But I think that is sadly common in some respects. You know, at least I can say that from the perspective of someone who has published a lot of research within, you know, the trans communities. Yeah, a lot of people who I've spoken to that have gone towards the medical path of transition have experienced all of these barriers and often all at once. So yes, thank you all for being here, I guess is what I'm trying to say.
Corey, I wanted to follow up on a comment that you made before our next question. You kind of, there was a lot that all of you shared with us. But at the end of what you said, and the gatekeeping, and I wanted to circle back to that. Can you talk to us a little bit more about the gatekeeping piece?
Yeah, absolutely. I mean, I think that there's just kind of the who's worthy of care in general. And actually, Oscar, I want to thank you for bringing up your age, because that reminded me of how much privilege I come to this situation with, right? I'm white, I'm masculine, I'm, you know, now I pass of a whole complicated thing about that language. People see me as cisgender and heterosexual most of the time, which is bizarre to me. I'm still getting used to it. I'm educated. I have just a ton of privilege, and I still, you know, get overwhelmed navigating some of these things. As for the gatekeeping, I think, you know, there's a lot of stuff like what letters do you need, and needing a diagnosis, right? If you want to use insurance, you know, you have to be diagnosed with gender dysphoria disorder, which is a whole separate soapbox I could get on. And you know, whether or not you have to pay for a session to do a letter, or to get a letter, whether or not someone, you know, determines whether or not, well, you've got, other stuff going on, and therefore we can't give you this, right? You've got other mental health things, and therefore we can't, you know, provide you this medical care. And there's just a lot of gatekeeping of who gets what care, right? I'm making assumptions, but a lot of the people I'm seeing on my screen are white. You know, whatever my experience is, it's not going to be anything near what, you know, a BIPOC person is going to go through trying to figure out this stuff.
Yeah, thank you. Thanks for expanding on that, Corey. Okay, for all of you, what do you wish medical and or mental health providers knew about when working with trans patients? You know, I think you sort of touched on your challenges a little bit, but if there are one or two things that you could talk about that would make life easier, what would those be? Corey, we'll start with you again.
Yeah. Again, I think for me, it comes back to the systemic stuff. I think we can get pretty narrow in our thinking. And that's for me too, right? So I graduated with my, you know, MSSW last spring. I just started working as a, thank you. I just started working this past spring doing full-time therapy. And it's been amazing. And I'm also been incredibly aware of how much I don't know. Most of what I do know is from my own experience, right? It's great. It's super helpful a lot of times. But I actually still need to educate myself about trans youth healthcare. I need to learn about blockers and what that means. I need to learn about the more of the science and experience for trans women. For, you know, great, right? I started identifying as non-binary 20 years ago. A very different world than where I had to explain to every single person I met what I meant when I said non-binary, and they kind of looked at me like, huh? But now it's the conversation is more there, which is fantastic, but it's a different conversation, and I've got to keep up to date. So it kind of doesn't matter, even with lived experience, like there's still stuff I need to learn, and just keeping up to date. And so I wish most providers knew that it's okay to be wrong. It's okay to have a growth mindset, not a fixed mindset. Like that this stuff is changing all the time, and it doesn't do any good to get defensive if you mess something up. Just move on, get educated, and do better next time.
Yeah, Corey, I really appreciate hearing your perspective as a provider on this question. That feels really helpful. Oscar, what about you?
Actually, I have like kind of an experience I experienced. I ended up getting hospitalized, and they asked me, how do I identify? And I was probably about 18, 19. And that was the first time I was like, I identify as transgender, female to male. And they looked at me and they were like, okay. They didn't quite understand what I was saying, and they weren't educated enough to understand, okay, what do we do? And I was like, well, I need to be, they had like the men's unit and the female unit. So they put me in the female unit, which in its own self was very difficult. And I had to explain to the nurses, and a lot of them were very understanding. This one nurse ended up backlashing, and that escalated to a lot of other things, especially, freshly, 18, 19, trying to learn myself and try to guide my own self, because at that time, my own self was my own support. And I only saw the doctor that I needed to see for 5 minutes. He ignored the whole fact of why I was, having mental health issues. And I tried to explain to him, because I identify as, transgender, and it's very difficult living in this world that it's like not very accepting or very educated right now and stuff. And he basically said, well, you're too young to understand, you don't know who you are as a person. And I sat there and I was like, oh, I'm glad you can decide for me who I am. And I got very upset, and I started getting angry almost. And because I got angry at the doctor specifically, they ended up taking me away, and I got punished because I was standing up for myself. And I was the only person in that unit that was able to stand up and say something, because there was 2 other people I was in the unit with who identified us the same way. And they kept their mouths shut. And I was like, it's okay. Like, I will stand up for both of us, all of us, because I don't like what's happening. And so if I had to come to the table and be like, what would be helpful for providers and medical professionals to understand or to help with, is learn your patient, but understand and try your best to guide them. Not every person that I've experienced, especially who are transgender, that have, I don't like, some of them have smooth experiences, but 90% of the time it's very rough. Talking about it and communicating it with other people. Yeah, sorry, I'm gonna stop. I could keep going, but I'm just gonna. But yeah,
There's clearly a lot, and we really appreciate you sharing those experiences. Yeah, what about you, Dr. Ross?
I would say not everything is a symptom or affected by gender identity. And each and every trans person that walks through the door or comes to the table will have a different set of experiences, albeit similar, right? Nonetheless, you cannot assume anything about a person's history, their motivations behind their identity, right? You certainly can't question someone's identity to say, oh, well, you don't know who you are. I'm sorry, excuse me? Oscar, props to you for managing that one, because, oh yeah, I would have had some words. And you also can't assume, right, what the impetus of the appointment is. It could be related, it could be completely unrelated. But nonetheless, any questions that are asked, they should only pertain to expressed reasons for the appointment and never, ever out of curiosity or just irrelevant reasons. Because, I mean, going to a provider as a queer person, right, as a trans or queer person is stressful enough, but then to have invasive questions come at you from all directions, and have to bumble through that experience. I mean, it starts in the waiting room, right? And depending upon how, they call your name, what pronouns they use or don't use, there's a whole, like, yeah, going to the provider, any provider, is stressful. So any way that you can make it less stressful is ideal.
Absolutely. Yeah. Thanks, Dr. Ross. And Corey, did you want to say something?
Yeah, well, I thought it was great, Kitty, for bringing up the name thing. It's funny, at the VA, I've had my name changed on all my documentation except for my DD 214, and so the VA insists on using my old name, and it's really kind of hilarious because a lot of the VAU show up and then they like yell your name. So they yell my very not masculine name, and I like stand up, usually wearing like something like this and boots and jeans and whatever. And I rode my motorcycle over to the VA, and I have maybe I have nail polish on, right? I have all these like very stereotypical masculine whatever. And then I'm all like, all right. But it's a little weird. And then I finally got my name changed with the VA, but they won't change my middle name. Right. So there's just weird stuff. But also the waiting rooms. It was definitely an adjustment for me coming down to the South, where like everywhere had a Bible. I was like, I'm getting an oil change and there's a Bible. I'm at the chiropractor and there's a Bible. And as a Jew, it was super weird. So yeah, just kind of like not really knowing what I was in for.
Yeah, quite a few symbols. Yeah, everywhere you look. Yeah, thanks, Corey. I wanted to follow up with you, Oscar, because you shared the really powerful story and appreciate that. If you feel comfortable, would you mind sharing a little bit more about like what you wish had happened? What would have made that experience tolerable for you?
Yes. I just have to think about it because like it's been like I like shove things down. Like I forget a little bit.
Sure. Take your time. And
yeah.
And again, no pressure.
No, you're good. So I was freshly, but not freshly, like 18, 19. I was struggling a lot with my mental health at the time, especially in a town that it's not very accepting. Layla, there was only one doctor in that town that diagnosed gender dysphoria and gave hormone therapy. But you had to go to therapy for about 1.5 years to even get diagnosed, even to get seen, even to get to go see the doctor. You had to do that. And I was like, I don't got the money, I don't got the time. I'm working so much, but I ended up getting admitted to the hospital for a 72-hour hold. I got in there, first time dealing with my mental health in my whole life. And I'm sitting down and they asked me, how do I identify? And I said, as a transgender man. This was before I was on hormones and everything. And the doctor looked at me and I'm going through my whole life about what I've gone through. And she just kind of was like, wow, this is the first time you've dealt with your health? I said, yes. And she's like, so when you say you're transgender, what do you mean? I was like, basically, I don't identify as how I was born. So I feel a lot more comfortable presenting and being a man or transitioning or trying to be, figuring out who I am. She's like, okay, I'll put this in the notes, but we'll definitely deal with your anxiety and depression. And I was like, okay. So I get into the place and I immediately get in there and all I hear is like my dead name, constantly, which isn't helping. And I've tried to correct it, tried to fix it, tried to get them to understand. I don't use that. I go by Oscar, and they were like, well, we have to go with what's on the paper. We can't go by what you want. I was like, okay. I didn't say anything. I went about my day, did my little puzzles, and then finally I got seen by the doctor. And like I said, it was a 5-minute altercation. He said, you don't know who you are. You're so young, you'll change your mind. You're just going to want to get out of this. And he's like, you know what? I think this is a big, big thing on your depression and anxiety. And I was like, oh, I don't think so. And that's kind of when I got upset and angry. And then I ended up getting taken out of the room. Going into this room by myself, crying, being segregated from the group because I had an angry reaction. Like, I was basically too aggressive to be out in the open. That's what they deemed it as. And I literally was I was so mad. I was screaming in the room, like, I don't feel like I'm too aggressive. Like, I'm just fighting, I'm standing up for myself and for the other people in this facility right now that y'all refuse to accept who we are. Now, when you ask me what I wish would have happened, I wished they would have took the time to understand, to talk to me, to help me, give me papers or give me a packet or something of like, hey, here are these other providers that we found in the area that maybe you don't know about. Because at that time, my knowledge was only of that one doctor to transition, to get on hormones, to do all these things, and I was already, struggling with my job at the time, coming out. And there was only like 2 other people, I swear, in the whole town that were like transgender. So it was very hard, coming out and not having a lot of support to back me up. At a young age, I was, kicked out. I was on my own because of who I identified as. So I wish there was a lot more resources within the hospital or a lot more guidance to help people instead of them ignoring that one thing. Because unfortunately, me being transgender doesn't stem from my mental health, but it definitely was a big part. Going somewhere and like, oh my God, am I going to pass at this grocery store? Are people going to address me as sir or all these things? And recently, at my job, I've actually, starting to get called he, him and pass. And I've had to fight for myself to be called, he, him, and sir. And this has just gone down a spiral. But yes, I wish there was a lot more resources and guidance. And I know, I forget someone who said where they have to feel like they have to educate a lot of people. I think it was Xavier who said that earlier, educating people. I've had to do the same. And sometimes it can be very exhausting. It's like, I feel like I'm the doctor in the room when I'm educating someone, and it was just perfectly fine. And I want them to ask these questions no matter how uncomfortable it can be, because I want them to know like they have an answer, they have someone, and they feel comfortable asking someone. But yes, if I had to go back to that experience, I just wish there was resources and guidance and an understanding. And I wish he would have just accepted he was wrong, like I think Xavier said. But yeah, that was the experience.
Thanks for following up on that, Oscar.
Yeah, of course.
Can I add in something really quick, Oscar? Like, so first of all, because I keep forgetting to say it, I love that your cat is trying to be in on the Zoom.
Yeah, I wasn't gonna open the door, but he'll sit like right here and he's just answer all these questions.
Exactly. That's fine. But also, so I don't know, the one of the things I would love to see in Knoxville, although I have not enough energy or coffee in the world to try to get it set up, is a trans buddy program, which is something that they have out of Nashville, out of Vanderbilt now. And basically, like, it sounds like it would have been kind of like the perfect setup for you, Oscar, but basically, like, you get assigned a buddy, and they will go with you to your doctor's appointments. They'll go with you to, right, if you get hospitalized, they're going to show up. They're going to be the ones that like bring you clothes. They're going to, and now it's to the point Vanderbilt kind of like took in the program, and they have a dedicated line. You show up at any sort of medical provider at Vanderbilt and you say you're trans, they're like, do you want a buddy? And they have like a direct line to get you someone. And it's something I would love to see here.
Yes. Wow. Yeah. That's the thing. Like, I didn't even I would never have known that. Like, I'm still learning, and that's amazing. I honestly, hit me up. I'll help out. I love that. I'll do it. I think especially not having a lot of support growing up, like even when I went to go get top surgery, my doctor's like, do you need a buddy? Do you need a nurse? Do you need someone? Like, we'll we'll get you someone to be there for you, because this can be very, this can be very exciting in the beginning, and then it could, I developed post-op depression very badly after my surgery. Not the best, but it happened. And my partner was constantly at work, so I was alone majority of the time. So I wish I would have had someone there for me, helping me. But yes, that's, yeah. Mhm.
I have two things to add, if I can, and they're very quick and simple. Oscar, you said something that reminded me of what I might call an age-old saying of correlation does not equal causation. And I think that's important to bring back up, that being trans or having any, non-cisgender gender identity and having mental health issues, those might be correlated, but they are not always the cause of one another in either direction. And then the second thing was about the Trans Buddy program. Some years ago, I actually applied for that job as the director of the program and didn't get it for various reasons. But yeah, I think that would be a phenomenal program for, a team who, like Corey says, has the energy, the time and the effort and the funds to do something like that. I think that would be awesome.
And it looks like there's already someone in the chat who's excited about doing it. And so I think that's a great idea, Corey. And it sounds like Oscar is excited about it. So if that's something that this conference yields, that would be so cool. Sarah,
Let me just interrupt really quick. We're going to do a quick attendance check for CE. So if you're still here, just type here in the chat and I'll record that. Thanks.
Sarah, do you want to, maybe while Sarah's doing that, I can handle the next question. Okay. I think we've covered the next couple. So I'm going to skip the next couple. And I will ask, are you guys aware of any community programs specifically targeting trans health, like support groups or HIV prevention programs? Two programs in Knoxville include Choice Health and Cherokee Wellspring. Have you used any of those programs? If you are familiar with them, why or why not? There are a couple more sub questions, but I'll go through the whole thing because I know that you guys have these questions too. So I will say, so the Gay and Lesbian Medical Association developed a list of the top 10 issues transgender people should discuss with their providers in 2012. So this was a while back, but at that time they said the top 10 issues were access to healthcare, health history, hormones, cardiovascular health, cancer, sexually transmitted infections and safe sex, alcohol and tobacco use, depression, injectable silicone, and fitness, diet, and exercise. Have you discussed any of those issues with your providers? Why or why not? And what have those discussions been like? And are there any issues you would add to this list? So I know that that's a long list of questions, but I also know that you all should have those questions. So let me know if you want me to repeat anything. Yeah, Corey, why don't you go ahead?
I'm not aware. It's funny, I actually wasn't even aware of those two. And so part of what I'm still doing is building my resource list. And there's another group, it's, I feel like sometimes we kind of end up recreating the wheel over and over and over again. But, I know there's a organization, I do not know enough about this one group. Basically, like they had developed a screening program for providers, and then they every year would re-screen the providers to see if they were still like culturally competent and educated and up to date. I remember when I was doing my first year site placement, and I was working in Jefferson, Cock and Granger County jails, trying to get folks into treatment. And I had a young trans woman, and I finally, months, found found a place that would take her. And meanwhile, she just was stuck in jail. And there was like one place in North, I think it was one place in North Carolina, was the only place specifically open to LGBTQ folks in recovery. And they didn't take people under the age of 25. So, I've heard that a new place opened up in Nashville. I don't know, again, don't know the details. And I think the community program specifically for trans health, I think part of the issue is how difficult it is to find them. And what are you searching for, and what does it mean? As for like the issues with providers, yeah, I do talk about that stuff. But I think again, it's like that overall, like, do I go to the doctor enough? No. Like, if I have insurance, when I have insurance, maybe. And I think again, just that like feels like too much work and not worth it, even though I know all the things that I should be doing. And then I guess like other issues like added or the health issues, again, I guess just it's still going to come back to the systemic stuff for me, right? Like, is depression and anxiety, because I'm trans, or is it like allostatic load, like the constant stress of existing in the world under, capitalism, and like there's just so much. And throwing like fat phobia in there, especially in the gay community, and just rocking out on all the terrible things. So I think just kind of how to get the word out about programs, and then how do you know they're vetted well.
Interrupt really quick. If you can't use the chat function, just say you're here, and if you need CE, say you're here in the Q&A function, and I'll get that.
I think the chat should be working now. But let us know if you have questions. Thanks, Corey. Yeah, just a whole lot of barriers. Oscar, what do you think? What are your thoughts?
I actually didn't know those actually existed. I'll be completely honest. I didn't know. The only thing that I remember is when I went to Planned Parenthood the first time I moved here, which was about a year ago. I've been here for a year. They gave me a list of, therapist, group therapy, a bunch of different things. And that's how I found my therapist now, which was great. And I love that. But other than that, I didn't know, I didn't know there were groups. And when I was looking over these questions, I was like, there's groups. Like, I was just shocked. I was like, oh, okay. So getting the word out and knowing that these exist, I Corey said, I mean, you have to figure out, are they vetted and stuff like that? And is this something that we can go to? I don't really know what to say because I've never really been to like a group. So I'm not really sure. I've normally just had to figure it out on my own almost, how to support myself or how to get support. And oh my God, my cat just launched up on the chair. I'm sorry. Nugget. Sorry, I don't know what he's doing. Nugget. Okay, there we go. Sorry, I don't know why he thought that was okay, but he wanted to say hello. And he's here for trans rights or human rights. Okay, he supports it. He has a little shirt. Anyway, moving on. But yeah, especially dealing with depression, anxiety. I always get anxious when I see a support group or something like that. I'm like, I don't know if I can go. It stresses me out a little bit because I don't know where I'm going. I don't know what I'm walking into. I don't know, what exactly this group could be for, so that's why I never really go, or I never know that they exist. I've definitely just had to develop a support system within myself and the people around me to kind of just be there for my mental health, not be there, but to know that, hey, I might need help, can you help me? And I've actually been, pushed aside sometimes. And I'm just like, okay, I got this. I'm a baddie. Okay. I can support myself. And especially like within work too. A lot of my experiences stem from work. I work in a very predominant field where like I'm seeing people all day, every day, like all day, every day, you know. I actually pushed for gender neutral bathrooms in our workplace, and I was able to get that approved, which I think is amazing. It was a lot of work because, you know, I'm not the only one that I work with. I'm not the only one in the workplace who don't identify as, you know, cis. And, you know, I went to my boss and I was like, hey, you know, what can we do to support us and to make us feel comfortable coming into the workplace at the end of the day? You know, I pushed for name tags within the workplace that have, you know, your name and then your abbreviation of he, him, you know, she, her, they, them, they, he, you know, anything. And I proudly wear my name tag at work because I want other people to see me and be like, oh my God, I'm not the only one. You know, I can go to you, I can come to you, and I become like a support system within my work for people who don't feel safe or comfortable. Um, I've had an employee come to me and they're like, hey, you know, do you have any resources? Do you have anything, you know, I need help getting like a binder, or I need help, you know, getting on hormones and all these things. And I was like, you know what? I can get you anything you need. You need a binder? I got you. I'll buy it. You know, I want them to feel safe at work, comfortable at work. I didn't have that, you know? So I guess you could say I kind of guess developed my own thing, but like, it's just nice to know, like, I didn't even know there were groups, but anyway, moving on.
Like the others, I also was unaware of the groups that were listed. The only one that I knew of that was, well, in existence, I should say, was there used to be, I'm not sure if it's still run, there's a transgender support group based out of Maryville. And of course, this was pre-pandemic, but I don't think they focused on anything specifically health related. But yeah, to my knowledge, I know I saw in the chat some time ago, someone mentioned, I think it was Samuel, mentioned Appalachian Outreach, which is a more recent nonprofit organization. And they've been really good about, you know, getting aspects of support for the, you know, trans and queer communities. But again, I don't think they're focused specifically on healthcare. You know, as part of my dissertation, what I found was that community, and I think this kind of echoes what Oscar is saying in terms of, you know, having to find support within yourself. Community is one of the biggest aspects that's missing, and that's part of the impetus of why I helped co-create Keep Knoxville Queer as a social group, right? As a way to kind of, you know, create events pre-pandemic to get people together and you know, be able to meet others of similar identities. But let's see, I'm just looking at my notes. Sorry, I'm trying to like keep the sun rays a little like off my face. But nonetheless, let's see. Okay, so one of the questions was about the topics discussed. My communication style is very transaction based. I'm very goal oriented, task oriented, like very structured, which often results in very matter-of-fact conversations, especially with healthcare. So of the topics that were listed, I've discussed healthcare, health history, access to healthcare, health history, cancer, STIs, and depression with multiple providers, because each of these areas has affected me in different ways, and I felt the need to inquire. Or, you know, sometimes the doctors would ask me specific questions about those areas, or on intake forms, right? There are certain things that you have to note. And with good doctors, these conversations went well, but with not so great doctors, it's been rather uncomfortable. Yeah, so I appreciate a doctor who can be candid but kind in these kinds of conversations.
Thanks, Dr. Ross. You mentioned that you founded Keep Knoxville Queer, and you were talking about there were social events pre-pandemic. I'm just wondering, for all of you, has the pandemic affected your access to resources, community, healthcare in any significant ways?
I think even outside of being trans and queer, I think everyone's been affected. I think that's fair to say. But yeah, I know I certainly have. You know, My partner and I often discuss whether or not we're taking the pandemic too seriously, because we are very, very careful within reason to an extent. And so we haven't hosted any events, in person. We tried the virtual thing, but we both work full-time jobs, and after being on Zoom all day long, getting on Zoom for a social call is one of the last things you really want to do. And so we've relied on more of our interpersonal, closer friendships and relationships. As we're comfortable, especially now that vaccinations are a thing, we've been able to gather with people who we feel safe gathering with. I couldn't begin to explain the amount of anxiety I had about going to just my regular health checkup. Not only because it was going to the provider, but also because I was having to go into a doctor's office where sick people go. I was not sick per se, and I had to sit around them, and I had to walk the same areas with them. And so there's, I would say the pandemic has affected me greatly.
Yeah, I mean, it's funny. I think in some of the ways the pandemic, I'm an introvert. I describe myself as a pretty gregarious introvert. In that, right, I'm not shy. I'll chat with people clearly. But I am also, would be totally fine living in a cabin in the woods. That said, I signed up to be part of the the Pfizer trial. So I actually got vaccinated last August. And, that was its own interesting experience, because I didn't know whether or not I had been vaccinated, thought I had been, whatever. But still, just that absolutely taking it, very, very, very seriously. And I ended up I taught myself to sew. I made masks. And financially, kept me in a hobby all last year. And I sold all sorts of queer and trans and fun masks. Some more appropriate than others for certain situations. But definitely affected community, I think, in a big way, a big sense of community, and just not spending time with anybody aside from my partner mostly. And then when at my job, when we went back in the office, it's even just been an adjustment to see people in person. And even though we're wearing masks and we disinfect and we do all these things, there's, it's certainly just, I think, like Katie said, it'll be, queer trans aside, I think it'll take a while to kind of address the trauma of the pandemic in and of itself.
Yeah, absolutely. Yeah, well, I'm noticing that we have maybe about 10 minutes left. We have a few more questions, but there are also some questions from audience members that we might want to address. And so I think maybe what we'll do is, Sarah, maybe you can ask that last question on our list, and we can do kind of a quick run through of that, and then see if we can take a couple minutes to address Q&As from the audience.
Sure. So the last question was, are there people in your life, friends, family you look to for medical and mental health support who are not licensed healthcare providers? And then, in what ways have you sought care from those people? Have you sought care from individuals in addition or instead of treatment from a licensed provider, and why? So maybe we can start with Corey again.
Yeah, so I'm looking, it's funny, I'm looking up the trying to think of the oh, I messed up the thing, looking at the wrong window. There it is. Mountain Access Brigade is a great resource. They do a lot of reproductive health access and abortion care. And I have not gotten care from them, but they're great for queer and trans healthcare, things like pap smears that can be awkward for trans guys, or really anybody. who has, you know, doesn't like to go to, you know, OBGYN. You know, and I think just, you know, they're not necessarily, you know, licensed. I think support groups, I haven't been to many support groups down here. But I think a lot of this stuff, especially earlier on when I moved down here, the Facebook groups, so many issues with Facebook. Mark Zuckerberg is terrible, and yet also one of the, I think, you know, best, sometimes only ways to find other trans people in the area. I was like blown away when I moved down here, and I'm like in this Facebook group with like 120 something trans guys, and I'm like, are there like 120 something trans guys in like Knoxville, Tennessee? And it's like more than all the trans guys I've known, and I've lived in like Chicago, Boston, Detroit, San Diego, Minneapolis, and I know more trans people down here than I know in all those places combined. And you know, but I think that so much information and health information is not gotten from healthcare providers. It's just not. We find it on the internet. We find it through peers. You know, we're all talking to one another, and that's how we end up with the education, you know, and the knowledge that we have.
Thank you so much. Oscar, do you want to go next?
Yeah, sorry, I was just like listening and processing. But yeah, actually, I a lot of my support from family and friends. It's always kind of been like that until like this past year when I really started focusing on my mental health to seek medical help. I've definitely feel like I've progressed a lot since from where I first began, where I've had to just like silently just live in the world, you know, kind of just like deal with my struggles on my own, which has been very overwhelming, especially, you know, just living in a world where it's like acceptable to some aspects, and then, you know, sometimes it isn't, especially from coming from a very, you know, southern side of Florida. You know, it's very difficult. I was like, I only knew 3 other people in the whole town that were like trans or identified as similar to it, and or non-binary. It was very difficult, you know, walking into work and getting misgendered or dead named all the time because no one wanted to accept you. And at that point in my life, I couldn't correct them. Like I couldn't. I was like, I didn't feel confident enough to do that. Actually had a situation happen at work where we actually had to wear masks. So wearing a mask really hid a lot of my masculine features in my face. So when people come in, they'd be like, oh, ma'am, I'm like, actually, I do use he, him pronouns. A lot of the times it went over smoothly. A lot of the times it did not. I've actually had my management team back me up. We actually had to kick someone out of the store because they wouldn't respect who I am as a person. And it wasn't like I was being harsh. I'd be like, actually, I do use he, him pronouns. And they'll be like, well, I can't tell you. I'm like, I'm just informing you. You misgendered me. I'm correcting you. And I just ask that you know, try. And it eventually led to the name tag situation. Like that's how bad it got, because the masks really hid a lot of everything. And then ever since we've had the name tags, I've heard my name Oscar more than I have in my whole life. And to have that feeling at work is just beyond amazing. They'll literally distinctly be like, thank you, Oscar, and I hope you have a wonderful day. I'm like, you too. Okay, thank you. But unfortunately, you know, I have a big, yeah, yeah. So I've had a big, you definitely used a lot of my support through family, friends, and work. But it's also nice to go into a workplace, and I know at the end of the day that they all have my back. And it really shone through the pandemic and through people who identify in the LGBTQ community to come in like that. Like that's the first time in my whole life I felt safe and comfortable to come into work and know that I am actually going to be okay. Like I know, you know, but yeah, that's me.
Like others, I've certainly gotten a lot of my support from friends and family, and most of that I would say is because I can often find more reliable information, especially when it comes to healthcare. as opposed to reaching out to a provider. Really quickly, because I know we're running out of time. I had one experience with a provider somewhat recently where I was inquiring about reproductive options in terms of nixing that, because I never intend to have children. And when I brought this up, my doctor said, well, you'll just have to, go find a doctor. And if they say no, find a new doctor and try that one. And I was like, well, that's a lot to ask, a lot of emotional labor for a visibly queer person, to which I got a shrug. Things like that prevent me from seeking healthcare advice and information from providers, because either they're not going to be kind or they just don't have the information. But yeah, much like Corey, a lot of the Facebook groups, there's other groups out there, that kind of share their own experience for the benefit of other trans, non-binary, and queer people, so that we can learn from those previous experiences. And I think that's part of the cycle of the trans community, is being able to share your experience like we are today, in order to not repeat the bad experiences, and yet prioritize and repeat the good ones.